You know, from what I'm told, if I had have had the flu vaccination, then I don't think it would have got as bad as it did. You know, they told me there was 3 or 4 guys my age, same sort of story, and they had a similar experience as what I did, like in intensive care. So yeah, they had 10 to 12 days when they didn't know if I was going to pull through. It's basically how it was. It wasn't like I crashed or anything like that. It was just, I was very unwell. Yeah, hello, my name's Steve. I'm 44 years old, live in Stevenage, family, work, and yeah. So I got the big flu bug that was going around last year, and over Christmas, and then it developed into double pneumonia. So it got to, I don't remember anything about Christmas Day, but it got to Christmas Day and I was just constantly coughing, and went to hospital, then was admitted to intensive care and then yeah, told I had double pneumonia. So really long story short, they basically wanted to put me asleep for a weekend to get my oxygen levels up, because my oxygen levels weren't getting anywhere, and that ended up being 19 days in a coma, because my oxygen levels just did not even out at all, and then apparently I had 10 to 12 days where those machines were just keeping me alive. So, and then yeah, after that I woke up, was in intensive care for a bit, and then to the respiratory ward for a couple of weeks, and then to you guys at the rehab ward. So I was in hospital for 52 days altogether. Getting there, like, the best way I can explain it is that I felt like a 90-year-old when I left the hospital, and now I'm probably feeling like I'm in my mid-60s. So, you know, I'm getting there. There's a lot that you have to do. It's been stressful. There's been bouts of depression that comes with when you come out of intensive care. It's all sort of part of it, and so it's been really difficult. Yeah. So I manage a mental health service. So yeah, so I've been off work for coming up 6 months now, and that in itself, I mean, that the adult inside of that, for anyone as well, like, you know, you're working in the NHS, and I know, similar to my line of work, you don't get paid what you should be getting paid, and, you know, sick pay kicks in, and, you know, and then the sick pay runs out, and it's been so stressful. Give me a sec. It's hard to repeat it. No, it's okay. No, you're not going to say sorry. No, sorry. You know, from what I saw, I spent 52 days in hospital, and in that time I saw some just like incredibly hard-working people who cared, like really cared. Like I can't tell you, waking up in ICU, it was that the way the nurses and doctors and everyone there was with me. I know all the medical things they did to me. So seeing how much people care, and all levels as well, you know, you don't want to be off work for 6 months. You don't get this, you know, if what happens to you happens to me, imagine not being able to, you know, you don't work in the NHS or anything like that if you don't want to help people, and you can't help people when you're recovering from this, trust me. You need help yourself. So for the sake of a 10-second boom and off you go, you might get the bit of sniffles afterwards, but what's that in the great scheme of things compared to what's, yeah, so